Hello everyone, it's me again, your virtual teacher. So these videos are for all nursing students out there. I know it's hard to remember all those terms and concepts right offhand. So everyone has their own way of remembering information, and that's why mnemonics are so helpful. Mnemonics is the study and development of systems for improving and assisting memory. Using mnemonics is an excellent way to keep things straight while also relating them to something less stressful. Mnemonics improve your memory by using the technique of association. So today, we will be learning nursing health assessment mnemonics. Have you heard the patient is unconscious, breathing, and talking unthought? The AVPU scale is a system where you can measure and record a patient's responsiveness to indicate their level of consciousness. It is a simplification of the Glasgow Coma Scale, which assesses a patient response in three measures: eyes, voice, and motor skills. The AVPU scale should be assessed during these three identifiable traits, looking for the best response for each. It has four possible outcomes for recording, and the nurse should always work from the best A to worst U to avoid unnecessary tests on patients who are clearly conscious. On the other hand, it should not be used for a long-term follow-up of neurological status. As I've said, the AVPU scale is a tool used to assess the patient's brain perfusion and function, and it also describes a patient's level of consciousness, where A, the patient is awake; V, the patient responds to a verbal stimulus; P, the patient responds to a pain stimulus; and U, the patient is unresponsive to stimulus. So the distinction between A and V frequently causes confusion. Have you ever yelled, "Sir, ma'am, wake up," to an intoxicated patient or stranger, and they raised their eyes, looked at you, or somehow responded to your voice? They are responding to a verbal stimulus. If the patient responds, "Why are you yelling at me?" the patient is A. So awake patients are always awake, and some adjective that describes their mental status of being awake. However, a patient that is V, P, or U cannot be alert, cannot answer history questions, or cannot describe their chief complaint. If the patient doesn't respond to a verbal stimulus, attempt to pain stimulus with a pinch, squeeze, or sternum rub. That's it for today. Until next lesson, remember, in your nursing health assessment, remember AVPU. This is your virtual teacher again. Stay safe and God bless.